Have you ever been handed a prescription for a medication you have never heard of and immediately gone home to Google it? If you have rheumatoid arthritis, you know exactly what I'm talking about. And if your doctor has ever mentioned a drug called Plaquenil, also known as Hydroxychloroquine, and you might have typed that word in the Google search bar and your heart was racing. Today, I want to walk you through exactly what this medication, the hydroxychloroquine or Plaquenil, does, why your doctors prescribe it, what the real risks are, and why it may be one of the most underrated tools in all rheumatology. Hi, all of you rheumatoid arthritis warrior. This is Dr. Ananta Subedi at the Rheum Doc, and let's learn more about Plaquenil today. Let's start with the story of Maria. She is 42-year-old, and when she noticed her hand felt different every single morning, she was worried. Every morning she wakes up, her hands are stiff. She was not able to close her hand. She told herself it was stress. Maybe she slept wrong. She pushed through it for many months. She took ibuprofen, was soaking her hand in the warm water with the hope that it will feel better. Until one day, she could not even close her hand. She was feeling so much pain. She was not even able to tie the shoelaces of her daughter. Finally, she decided to see a rheumatologist. And when she sat in front of the rheumatologist, she was hit hard with the diagnosis of rheumatoid arthritis. And her doctor recommended her to take this medication, the hydroxychloroquine or Plaquenil. You can imagine Maria's first reaction. She went home and she Googled it. She found a malaria drug for joint pain. She read more about eye problems, heart issues, and all of the other side effects that could come with Plaquenil. And she was worried. The side effect list was endless, and she almost did not even fill that prescription. Maria's story is like thousands of others rheumatoid arthritis warriors, and I want you to know that she almost did not fill her prescription. Maria's story is like thousands of others who are suffering with rheumatoid arthritis, and I want you to know what she did not know that day. Before we go further, let's first understand what is rheumatoid arthritis. Let's understand what is happening in your body when you have rheumatoid arthritis. Think of your immune system as your body's security team. Normally, it protects you. It fights off the bacteria, viruses, and anything that does not belong to your body. But in rheumatoid arthritis, that security team gets confused. It starts attacking your own joints, the soft lining called synovium, and the cartilage. And even it can cause bone damage underneath. And this is called a friendly fire. And if nobody stops it, over time, your joints pay the price. Stiffness, swelling, pain, and if left untreated, permanent joint damage. That's why we use medication called disease-modifying anti-rheumatic drugs, or DMARD. These don't just cover the pain like the ibuprofen. They slow down the disease. They protect your joints. And Plaquenil is one of these disease-modifying anti-rheumatic drugs. Here is the best way I can describe what hydroxychloroquine or Plaquenil does in your body. Imagine your immune system is a stereo blasting at full volume. Some medications are like yanking the plug out of the wall. It shuts off everything. They are powerful, but they shut down whole immune system. Plaquenil is different. Plaquenil is more like a volume knob. It turns the noise down to manageable level without silencing everything. It comes over reactive immune cells. It blocks the signals that keep inflammation going. And here is the thing I love about this medication. It is not just about your joints. Research has shown 3 things about hydroxychloroquine that most patients don't know, and most of the internet don't tell you. Number 1 is cholesterol. People who have rheumatoid arthritis who take Plaquenil have significantly better cholesterol levels. Lower bad cholesterol, higher good cholesterol. Number 2, diabetes risk. A major review found that people on hydroxychloroquine has a lower risk of developing type 2 diabetes. And the number 3, and that matter the most, your heart disease. One of the studies found that hydroxychloroquine use was linked to fewer heart attacks and strokes. Now you might wonder, why does this matter so much? Because the number 1 cause of death in people with rheumatoid arthritis is not arthritis itself, is the heart disease. So a medication that treats your joints and help protect your heart, that is a big deal. That's why Plaquenil is so helpful in managing rheumatoid arthritis. So this question comes up a lot. Why does a rheumatologist actually reach for Plaquenil? There are 3 scenarios. Scenario number 1, early mild disease. If you are newly diagnosed with rheumatoid arthritis and your RA is mild, the American College of Rheumatology actually recommends Plaquenil as a first-line option. And the reason is, it is well tolerated, it has a favorable safety profile, and is easier to take the pill. Scenario number 2, a combination therapy. When methotrexate alone is not enough, rheumatologists can add Plaquenil alongside sulfasalazine. And this combination is called triple therapy. That includes methotrexate, sulfasalazine, and Plaquenil. Scenario number 3, the cost. Biologic medication, the newer, more expensive options, can cost tens of thousands of dollars a year. And many of you who are living in other parts of the world, you may not have access to those medications. But the triple therapy with Plaquenil costs a fraction of that. And for many patients, it works just well as other biologics. It is also cost effective, so easier to get anywhere throughout the world. Now let's talk about what Maria found on Google that scared her. First thing was the eyes, the side effect on the eyes due to Plaquenil. And this is the most talked about risk with long-term use of hydroxychloroquine is the retinal toxicity, the potential damage to the back of the eye. And I want you to hear this very closely and clearly. At the correct dose, no more than 5 milligrams per kilogram of the body weight per day, the risk of eye damage is less than 2%. That is even after 10 years of use. And the key is regular screening. A baseline eye examination when you start, and annual screening after 5 years of use of Plaquenil. If any early changes are caught, they stabilize once the medication stops. The most common day-to-day side effects: mild nausea, which usually improves when you take it with food. And the serious side effects are extremely rare. The regular check-ins with your rheumatologist are what keeps you safe. Now let me come back to the triple therapy for a moment, because the numbers here are remarkable. Methotrexate, sulfasalazine, and hydroxychloroquine. These 3 medications works together as a team. A landmark study published in the New England Journal of Medicine found that 77% of the patients on triple therapy achieved major improvement. Compare that to just 33% on methotrexate alone. So 77 on triple therapy versus 33% just on methotrexate. And these 3 pills, the methotrexate, Plaquenil, and sulfasalazine, they are affordable pills and work as powerful as a team compared to biologics. And Plaquenil is a quiet teammate in this triple therapy. Now you might be wondering, what happened to Maria? She almost did not feel that prescription. But after a long conversation with her rheumatologist, one where she asked every question she had been afraid of to ask, she decided to give it a try. Within a few months, the morning stiffness started to ease. She could grip her coffee mug again. She could button her daughter's coat easily without any problem. Later, after a couple of months, she had another flare, and her doctor added methotrexate and sulfasalazine on top of Plaquenil. And within weeks of this triple therapy, she felt the difference again. To add more, her cholesterol also improved. Her rheumatologist told her Plaquenil may be protecting her heart too, something she never expected from a rheumatoid arthritis pill. Today, Maria is having a good control of her rheumatoid arthritis, and she is enjoying her life and her time with the family. Now, here is what I want you to take away from this video. Plaquenil is not the loudest drug in this room of rheumatoid arthritis. It is also not the newest one or the flashiest one, but it has been helping people with rheumatoid arthritis for decades. It gently calms the swelling and it protects your heart. And it works beautifully alongside with other medication as a good team player. All of you rheumatoid arthritis warrior, if you have been prescribed Plaquenil and you are nervous about it, I want you to do one thing. Have an honest conversation with your rheumatologist. Ask every questions you are afraid to ask. That conversation could change everything on how you manage your rheumatoid arthritis. And as we know, early treatment changes outcome in rheumatoid arthritis. Don't let fear make the decisions for you. If this video helped you, please subscribe to our channel. Please like this video and share with other people who might be scared with Plaquenil. We are working together, getting the right information to RA patients everywhere you need it. Please leave a comment below. What question do you have about Plaquenil or any other RA treatment? And I read those every single one. And I'll see you in the next video. Bye-bye.